Do you think that there's some benefit that might be able to be derived that maybe you can fill in those gaps? Obviously, not going to be everything you need, but a physician who doesn't have a social worker at their disposal, taking the social worker course, you can learn a little bit of those skills. Is that kind of, do you think, an added benefit of providing sort of these targeted audiences here for maybe the people who don't have access to those care members?
I absolutely believe that. I mean, if you really can't add a social worker to your team because of financial limitations or barriers, just even finding someone qualified and interested locally to fill that role, I do think that watching these courses as they unfold or as we roll them out, I do think that gives you a sense of what that person can bring to the table. I've been fascinated myself. We have an incredible team training program at the foundation that's been running since 2004. And the whole point of that program is just an in-person training and virtual training is to help team members actually understand what other team members do. And so to your point, a lot of times you don't realize what a social worker can do on a team. I've stood in front of a room of healthcare professionals, diverse healthcare professionals, and I've said, okay, all of our occupational therapists, keep your hands down. Everyone else, tell me, do you know what role the occupational therapist plays on a team? What can they actually do to help your patient when they have, say, cognitive decline? What role can an OT play? No one raises their hand because they don't know what an occupational therapist does. And these are even people with team members. They don't fully understand what their own team members can do. So if you don't have the team member, you're even more removed. So I do think that this is a wonderful opportunity. If someone's at that point where they're thinking, yeah, I've heard a social worker would be nice to have on the team, I don't really understand what value they're going to bring. Maybe you watch this course and you think, oh, those are all the things a good social worker working in the movement disorder space could do. Now I understand the value. I'm going to bring them into my team. So I think it's a couple of things. One, you understand what they do, and you could then perhaps try to fill in some of those gaps that you don't have. You might also realize and understand the value of having a social worker on your team. And then you might say, okay, this is worth it. I'm going to bring them in. So it's a constant conversation.